Good afternoon. I'm Dr. Joss Reimer, medical lead for the Vaccine Implementation Task Force. I want to get started by clarifying some of the questions that came up last week about the prioritization of congregate living facilities. There are nearly 23,000 Manitobans in congregate living facilities. This can include assisted living, group homes, supportive housing, homeless shelters, correctional facilities, family violence shelters, residential addictions treatment facilities, and elderly persons' homes. Many people living in congregate living facilities will be reached by our focused immunization teams, who will be visiting hundreds of sites in the coming weeks as vaccine supplies allow. Planning for this is an incredible undertaking, and we have prioritized these immunizations just as we did with the personal care homes. Nos équipes de vaccination ciblées visiteront la majorité des établissements, de centaines d'entre eux, dans les semaines à venir, lorsque nous aurons reçu suffisamment de vaccins. La planification de ces visites exige d'énormes efforts et nous devons donner la priorité à ces vaccinations, tout comme nous l'avons fait pour le foyer de soins personnels. We need to start with the locations assessed as the highest risk, and that is based on a number of factors. Last week, a draft planning document was made public that showed residents of a correctional facility would be immunized first. And while the correctional facility is assessed as a medium priority, it is not first on the list. The people putting the schedule together did what we would expect in most circumstances. Public health staff were going to that facility on that day, and so they felt it would make sense to do the immunizations at the same time. But the COVID vaccine is not a typical public health service, and so we have to allocate vaccine based on what the science is telling us and our assessment of risk. And we also need to show Manitobans that we're doing that. So the question is, are inmates in correctional facilities going to be immunized as part of our congregate living outreach? Absolutely. But there are other folks in other settings who will be immunized first. We learned from this experience and we move forward. So today we are releasing the list of where we'll be going for the next congregate living facility immunizations. As you might recall, we are limited to Winnipeg and Brandon due to vaccine supply. However, we are going to share the entire list of congregate living facilities in Manitoba so that everyone can see the scope of this work. And we will continue to update you regularly on how we are immunizing the people living in these settings, because I think that that's important to share with Manitobans. Today, we are also opening up eligibility criteria for immunizations at our supersites to include employees of congregate living facilities based on age. Par ailleurs, aujourd'hui, nous élargissons les critères d'admissibilité à la vaccination dans nos supercliniques pour inclure les personnels des lieux d'hébergement collectif. We will begin with those employees born on or before December 31st, 1955. So I ask that staff who are working at congregate living facilities, please take a look at the list that we're publishing to determine if your workplace is eligible. Because we are continuing to expand the eligibility criteria, we've hit a point where we need to publicly release the phone number to book an immunization appointment. So if you are eligible, please call to book your appointment. We have spaces available, and I'd encourage you to be immunized when it's your turn. To the other Manitobans out there who aren't eligible yet, please be patient. I know that this is difficult, but I want to stress that there's a screening tool in place, and only people that meet our criteria will be able to book an appointment. Aux autres Manitobans qui ne sont pas encore admissibles, je souhaite dire ceci: je sais que c'est difficile, mais je vous demande d'être patient. Je tiens à souligner que nous avons mis en place un mécanisme pour vérifier l'admissibilité et que seules les personnes qui répondent à nos critères pourront prendre rendez-vous. If you're unsure, the eligibility criteria are posted on our website and updated regularly. The last time that our phone number was unintentionally made public, we received hundreds of thousands of phone calls. So I am asking Manitobans, please do not call until you're eligible, so that eligible Manitobans are able to get through and book appointments. I also want Manitobans to know that we are moving closer to being able to open up the phone line to the general public, beginning with Manitobans who are over 95. I know this is something that many Manitobans are looking forward to for themselves and for their loved ones, And so I'm looking forward to being able to announce next week that we'll be opening up to elderly Manitobans. So again, I want to reiterate that Manitobans over 95 are not eligible today. Please do not call to book an appointment this week, but I will let you know next week when that changes. And finally, I want to speak briefly about the new guidance that has been recently released by the National Advisory Committee on Immunization. We are aware of the categories for essential workers and individuals with health conditions, and we have tables in Manitoba that are looking at both of these groups, and we will be taking NACI into consideration at those tables. At this time, no decisions have been made, but we are committed to keeping Manitobans updated as we move through those tables. We also know that racialized groups face many systemic barriers. We are committed to consulting and working with community groups and other key stakeholders to address those barriers to accessing the vaccine and build on the recommendations on how best to reach those individuals. So to be clear, migrant workers, asylum seekers, and others who are in Manitoba but are not citizens will have equitable access to vaccine. So at this time, I'd like to turn it over to the co-lead of the vaccination task force, Johanu Botha.
Thank you, Dr. Reimer. Good afternoon, everyone. I'm Johanu Botha, lead of operations on the Vaccine Implementation Task Force. As many of you might already know, Manitoba is putting plans in place today, even though vaccine supplies are low, so that we are ready when they're expected to surge in what we call Q2 or the beginning of April. Our goal is to be ready to provide 1.5 million doses of vaccine in Q2. And to do that, we have to give 20,000 doses of vaccine a day or be able to do so. Right now, we expect to give an average of about 1,000 doses a day throughout February, based on the vaccine supply projections from the federal government and what we have received to date. But to give you a truer picture of what we could be doing if vaccine supply was not an issue at this time, we have started reporting our daily maximum capacity to mark our progress to achieving 20,000 doses a day. With our supersites, focused immunization teams, and pop-up clinics, we are already well on our way to meeting that target. We have also recently opened applications to doctors' offices and pharmacists so that we can begin offering immunizations in those locations once a suitable vaccine has been approved for use. The response has been really positive so far. As of February 15th, 122 medical clinics and 9 pharmacies are registered to deliver vaccines, with 182 more pharmacies getting trained and support to come online. We can see how this is moving the needle in our daily maximum capacity already. With those clinics and pharmacies that are now ready, our daily maximum capacity has reached 10,199 doses per day. That means we are halfway there, and our work is not done. Manitoba committed to establishing a supersite in every regional health authority. Today, I can confirm that the next 2 sites, expected to launch within the first week of March, will be in Selkirk, in the Interlake Eastern Regional Health Authority, and in the Morden-Winkler area in Southern Health, Santé Sud. These sites were chosen for a number of reasons, including geography and population density, as well as a number of logistical criteria. Yes, they will be used to provide immunizations, but they will also serve as hubs for our focused immunization teams and pop-up clinics. And when Selkirk and Morden-Winkler are ready to open, we will update our daily maximum capacity once again. When you consider all of the locations where Manitobans would ultimately be able to be immunized in the weeks and the months ahead, whether that's a supersite or a pharmacy or a pop-up clinic or a personal care home, we're talking about hundreds of locations province-wide. Before we wrap up and take questions, there is just one area that I wanted to touch upon today. It's true that we need vaccine and people and the right locations to make this immunization campaign happen. But it also takes freezers and swabs and syringes. Manitobans have benefited from a procurement, logistics, and distribution team who have done such an incredible job that we really haven't had time to talk about them yet. They have secured the supplies we need for this immunization campaign when every other jurisdiction in the world was trying to do the same thing. We need ultra-low temperature freezers. We need swabs. We need cold packs and storage containers to transport the vaccine. And consistently, Manitoba has been able to get 1 extra dose of vaccine from every Pfizer vial, 6 instead of 5, because we have had a supply of 1 milliliter syringes to draw each dose. Because of these syringes and the skill of our immunizers, Manitoba had 7,800 more doses of vaccine to immunize people. And in times when vaccine continues to be in short supply, those doses make all the difference. Thank you. We'll now open for questions.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 2 follow-up questions this afternoon. Up first from CBC Radio Canada, Matthew.
Thanks, Paul. My question is, how many doctors and pharmacists are you missing for your April vaccination plan of 20,000 doses per day?
So we're currently aiming that they will take 25% of that daily maximum capacity, so around 5,000 doses per day.
Okay, thank you. I don't have a follow-up question.
From CBC Manitoba, Bart.
Hey, Dr. Reimer. Forgive me, I'm a little bit confused by your opening statements here. So the original announcement about the inmates in provincial jails was an error? Is that what you were saying? Can you clarify that?
Sure. So the original statement that we made about congregate living facilities was just that we were creating a prioritization process that was based on age, based on the setup of the facility, and on the health or cognitive condition of the individuals living there. At the last presser, it was brought to my attention that a draft document had been made public, which had been flagged as showing one of our correctional institutions as being top of the list. So I wanted to ensure that we got on the same page today to indicate that our correctional facilities are absolutely priority congregate living facilities, and we will be addressing them. We're working with the Department of Justice to determine the best way to do that. But they are not the top of our congregate living facility list based on age, health and cognitive conditions, and facility setup. So they are considered more of a moderate risk, and they will be prioritized accordingly.
Okay, thank you for that. You stated that the full list is being published. I see just a list for this February 19th, 26th, Winnipeg and Brandon. Is there some other, you say it's in reports, is there some other list that's already published or that will be published at a later date?
Well, I don't have access to the website right now, but if it's not already there, we will be publishing the full list of facilities. I will flag that there's quite a large number of small group homes that won't be listed by name because they don't have names, but we are still working with the Department of Families to address those facilities, even though they won't show up in the list, the public list that we will be releasing or have already released.
All right, thank you very much. And this morning, we had some indication that we're going to see larger quantities in March of the Pfizer-BioNTech vaccine. Will this translate in March into increased vaccination in March itself? As soon as some of those supplies get here, you'll be making those appointments. Is that going to happen as soon as the supplies arrive?
Well, I would say that we book appointments before the supplies arrive. So we've received the commitments from the federal government about what our allocations are. And so we continue to expand our eligibility to book into the future for what we anticipate we'll be receiving. So as those numbers go up, the number of eligible Manitobans will match.
From the Canadian Press, Steve.
Dr. Reimer, this morning there was some talk of opening up many more supersites in the months ahead. Will you need supersites across the province as doctors and pharmacists are able to distribute and administer vaccines?
I'm going to let Johanu take that question.
Sure. Thanks for that, Steve. Yes, we will. So if we look at the breakdown for our daily maximum capacity, that 20,000 per day benchmark that we're aiming for, the focused immunization teams and the docs and the pharmacists will play a critical role, but the heavy hitters really will be supersites. They're the ones that will get us there faster, and ultimately probably take around 70% of the 20,000 doses a day. So yes, we will need up to 13 down the line to do that comfortably every day.
Okay, and a follow-up question on the prison stuff, because I'm a bit confused too, provincial jails and federal prisons. Am I understanding correctly that when teams go in there, they'll be administering to everybody? You're not going to send in a team to do part of the population, either inmate or staff or whatever, and then go back for a second set. It would be everybody in the facility at once, correct?
So when we attend congregate living facilities, our focused immunization teams provide immunization to residents of those facilities, not necessarily to staff. So that would be the same thing in corrections, where it is the inmates that we are providing the immunization to. But I will flag that, and I believe it's today, that correctional officers, for example, who are staff of congregate living facilities, those who meet the age criteria are now eligible to be immunized at one of our super sites.
Oh, okay. Thanks for clearing that up. And final question is, there's been a hiccup because of the weather in the U.S. There's a minor delay of a day or two in the big supply dump that's coming to Canada. Does that affect anything, even in Manitoba?
I can field that. So, I mean, our planning team is constantly monitoring information coming from the federal government on the doses that we can expect and that are sort of locked in, that we have line of sight on. And so we really rely on them to give us that information. And at this time, we haven't got a blip on what kind of impact that might have had.
From CTV Winnipeg, Michelle.
Hi, Dr. Reimer. Can you explain how we got to the point where we can start vaccinating the oldest people of the general population next week?
Well, I mean, we got to this point with two things in mind. One was the excellent planning of this task force, all the work that they've done, setting up our clinics, setting up the focused immunization teams, to be able to have all of the supplies, all of the staff, the facilities, the freezers, the security, all of that ready to go for when we got the second half of that, and that's the supply of the vaccine itself. So based on the estimates that we're getting from the federal government, it's looking like we can open up to Manitobans over 95 next week. I also want to flag that we don't normally announce ahead of time that people will become eligible, in part because we don't want people to start calling the call center before they're eligible. But we also know that many Manitobans over 95 are not going to be going on our website and may not be watching this press conference. And we wanted to give some time for their families, for some of our community groups, for some of the facilities where these folks live, to start working with them, to start working with us on how best to get these folks to the clinics, how best to book their appointment once they are eligible. So to answer your question, the supply and then the preparation of this team is what got us to this point today, or next week, I should maybe say. We really just want to have this extra week of time to prepare for some of the additional needs that these Manitobans will require.
Great. And for Johanu, I would like to ask you again, why did you choose Morden and Selkirk as the next two super site locations?
Thank you. No, it's a great question, and this is something that the operations and planning teams have sunk their teeth into over the last couple of weeks. There's really two criteria that we use, and similar to how Dr. Reimer uses evidence to inform her eligibility criteria, we use evidence on the operations side to make these kind of decisions. And the two key pieces to that is population density. So within each region, how can we maximize the swath of people that can be served by a super site? But secondarily, and it's just as important, is that it has to act, this first super site in the region has to act as a distribution hub for the operating base, if you will, from which we can deploy fit teams and deploy pop-up clinics. So subsequent super sites will populate the rest of the region. We know there are residents across Manitoba that need convenient access to vaccines. They will have it. But for this first foray of super sites, we need it to be in a central geographical location as close as we get to it within each region.
Okay, and lastly, I'm wondering about the prioritization of these congregate living settings. Age is listed as the top, I guess, factor. So is that still, are you doing the oldest people first? Is that how it will eventually roll out?
So we created a bit of a formula where we looked at age, we looked at the health and cognitive conditions that the folks in those facilities have, as well as the setup of the facility and how well they can follow public health measures. And we weighted age as the most important of those factors. So while it's not strictly based on age, because as I mentioned, we are also considering the health and cognitive conditions and the facility setup, age is the most important of the factors when determining the final list.
From City News, Jonas.
Good afternoon, folks. This morning it sounded like we may have gotten a little more clarification on vaccine deliveries from Pfizer. The totals, I believe the date was up to March 29th. Just want to run down what Manitoba is getting versus what was expected and what we're going to have on hand in those delivery dates.
Thanks. I'll take that question. So we made sure that we had those numbers after the question at the technical briefing. So for Moderna, we don't have any visibility into March at this point. We've only been given the numbers for February. We had originally been expecting to get 16,000 doses. We're now getting 14,200. So we're getting 1,800 fewer doses of Moderna in February than we had been expecting. For Pfizer, I can speak to the end of March. We had originally been told we'd be getting 81,900 doses. We're now being told it will be 74,880 for a net loss of 7,020 doses.
Thank you very much for that, Dr. Reimer. As a follow-up, this sounds, I guess, kind of positive maybe, that vaccine delivery is going to pick up again, and just confidence on supply moving forward. Do you think we're getting over the hump here?
Yeah, I mean, vaccine supply chains are unpredictable. We see that outside of global pandemics. We see that, with our measles, mumps, rubella vaccines, for example. So it certainly seems that we've passed this hump and that the supply should be increasing as we go forward. The federal government sounds very optimistic that we can expect the numbers to continue to increase going forward, but we also need to plan for what we know will happen again. We don't know which company it will be, but at some point there'll be another disruption. And so we need to be ready for that to occur with any product at any time. So to answer your question, am I optimistic about the supply increasing and the stability? Absolutely. It seems like everything is a go for supplies to continue coming in, but we need to also plan for what we know will happen at some point.
Thank you again for that, Dr. Reimer. And just as a final one, personal care homes are on track to be completed by the end of this month. Just maybe a thought about what this means for the overall impact on the health system and how much this second dose will really, I guess, help ease the burden on the hospital.
So the personal care homes being finished shortly is one of the exciting things that we get to report on in these press conferences because about half of our deaths have occurred in personal care home residents. So we have, I get a daily update from the Winnipeg personal care homes about outbreaks. And every day, those numbers are going down. The numbers of outbreaks that we're seeing right now is the lowest we've seen in many months. And so it's so encouraging to see that report every day and see it get better day after day and know that the residents living there are at that much lower risk every day. So, the overall decrease in deaths associated with getting this population done should be substantial. But we also know that that's going to take a little bit of time before we start to really see the benefit of those vaccines. So we look forward to seeing those numbers continue to come down. We also know that these are the individuals who make up a decent proportion of the people who ended up in hospital or ICU, but less so than the number of deaths. So we anticipate we will see some improvement to hospitalization numbers and ICU admissions, but the most dramatic improvement will be in a reduction of deaths.
From CHVN, Taylor.
Hey, good afternoon. You announced new sites opening up in Selkirk, Winkler, Morden area. Can you explain a little bit more why these are going to be opening up, even though right now we are seeing a bit of a shortage in vaccines?
Yeah, no, it's a great question, and that's why they won't be opening up right now. We're aiming for the first week of March, and around that time, given our forecast, it looks like we'll be able to open with about one tray on each of them, one tray of Pfizer, so around 1,000 appointments, which is again very, very low for how much we can push through there over a week. So that'll open. It's good to have them run. It's good for us to have those regions active. It's good to get them ready as distribution hubs for when we get more vaccine. But to your point, they won't be pumping out the kind of vaccine that we know they will be able to do come quarter two.
Thanks. And can you also explain a little bit more about why these particular locations are opening up before others? I know you've got over a dozen planned, but yeah, just why these two particular locations are some of the first to open.
Yeah, for sure. So our planning principle has always been to take a phased approach. So we started off with the super site in Winnipeg. We identified lots of best practices through that approach. There was lots of lessons learned, and now we can apply those as we move forward in our planning. We wanted to do that process first as we expanded to other regions. So that's why we take that kind of phased approach. The big thing, too, to keep in mind is that supply volatility being low at the moment allows us to take those lessons learned and do this over a steady period of time. The big thing is we'll be ready to pump out 20,000 doses a day come April 1st.
Thanks. And the next group of people would be Manitobans over 95. How are you going to make sure that those folks who want a vaccine are able to get one? Right now, it seems like there's a bit of a reliance on caregivers.
Yeah, that's a great question. And as I mentioned, we don't normally give a week's heads up before opening up eligibility because we do worry that it's going to create some confusion about when people become eligible. But for Manitobans over 95, many of them are going to require additional considerations, additional assistance, and likely are not checking the website to find out when they're eligible. So we want to have this next week where we can work with some of our government partners, some of our community partners, with loved ones of those folks over 95 to try to address the transportation needs, to ensure that the processes that we have at our super sites are appropriate for this group. So we just wanted to give that extra week to be able to work on all of those logistics. We also recognize that the super site is not the perfect model for everyone. And so we will have to continue working hard to ensure that for those Manitobans who can't go to one of our super sites, that we're keeping them in mind as we develop other mechanisms to reach all Manitobans going forward.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. I was wondering if you can provide an update. So of the total healthcare workers identified for stage 1 immunization, how many have received the vaccine?
So we don't have the exact number that have received. It's actually been a few weeks since I got a report on the uptake percentage. The last time I heard, we were going between 70 to 80% of eligible healthcare workers attending for their vaccine appointment, but I don't know if that number may have changed over the last few weeks. What I can say is that we have opened up eligibility to everyone in our stage 1 list for healthcare workers. with the slight caveat that we are working with the Department of Families on some of the group home staff and booking them in a partnership approach with the Department of Families. So we have already begun on our stage 2 for healthcare workers. So we've announced that healthcare workers based on a certain age criteria in some outpatient settings, for example, are now also eligible. And so we will continue to work on our stage 2, which, as I mentioned, also includes staff of a specific age at congregate living facilities.
Thank you very much. I was on the recommendations from NACI. So if the province chooses to open up early vaccine access to people with an underlying health condition, do you have a database of eligible Manitobans that you can use to guide that eligibility?
So there's no single source of data that would compile all Manitobans with all health conditions and be able to tell us exactly who should be eligible. But what we are doing is we have a medical advisory table, which has expertise from a large variety of different specialties within medicine. And we've been meeting with them to identify what are the highest risk conditions that we're seeing Manitobans ending up in the hospital, ending up in the ICU. Because if we do go that way, we want to make sure that we're still following the science and that we are expanding to who we know is highest risk. And some of those may be surprising, some of them not so much. Likewise, some of the folks who might think that they're high risk, what we're seeing is that they may not be. So that's why we have that table of expertise working on it. We use data from the Manitoba Centre for Health Policy. We use data from our Government Epidemiology and Surveillance Unit. We also use national and international data to inform this process. But that group has been tasked with being ready with a list should we open up to people with specific health conditions.
Thanks. And further to that, what does the Manitoba data tell us about the risk of COVID-19 for racialized Manitobans?
So I don't believe we released the data on that yet, but I can take that away and we can get an answer back to you on that.
From Global News, Brittany.
Good afternoon, Brittany from Global News. I'm wondering if you can give a bit more information on the priority list for the congregate living settings. I know earlier we spoke a little bit about what it meant for people in hospitals. If you could just give more of an idea of who those people are in general for the congregate living settings that are high priority.
Sure. So when we use the term congregate living facility, I mean, that's not a term that we use in general in life to describe facilities. But when we're using it, we're saying, facilities where people are sharing their living space with multiple other non-household members. So that includes most obviously things like personal care homes, like shelters, but it also includes facilities like supportive living, supportive housing. Some of the assisted living have some shared spaces as well. The group homes may have things like shared kitchens. The correctional facilities have a number of shared spaces. So any of those facilities where people are living together with non-household members and sharing their living space with those non-household members has been included in the list. And then how we decided within that list who to prioritize was based primarily on age. That was the factor that was the most heavily weighted in our calculation. But we also took into consideration the health conditions of the folks who are living in those facilities, as well as their cognitive status. We looked at things like how much assistance do they require for activities of daily living, or how much assistance do they require to manage their medical conditions. And then finally, we looked at the facilities themselves and how reasonable it is to follow public health measures in those facilities. Are they able to use personal protective equipment? Are they able to follow physical distancing or not? And then using all of those factors, we then created the list that starts with our highest risk groups, being those who score the highest on those different factors, and moving down.
Thank you. And I'm wondering, besides the actual vaccine itself, do we have enough supplies to get up to this 20,000 vaccinations per day when we're talking about freezers, syringes, and all that type of other supplies that are needed?
Thank you for that. Absolutely, we do, and that's been one of the wins for our task force. The procurement team has been, on the ball with this early on, and so what we really get from the federal government, is really vaccine focused. So we have to envelop that with almost everything else, and we're well on our way to be able to set up all of our super sites by April 1st and support our fit teams and pop-up clinics as need to.
Thank you. And I'm wondering, for my last question, when we talk about immunization, we have been using that 12-hour a day at the super site. Are we going to need to boost that further than that to get that 20,000 per day?
We absolutely can. We'll be able to, we're aiming to be able to run our super sites and then plug it in with the pharmacists and the docs comfortably with a 12-hour a day cycle. But we have plans in place to push it to 18 hours a day and plans in place to push to 24 hours if need to. We need to be able to ready to do that in the unlikely event that we get that much vaccine to work with.
From the Brandon Sun, Drew.
Thank you. A little bit earlier, we heard that there were, I think, around 131 physicians and pharmacists signed up to give the vaccine. I'm just wondering if you know at this point why more haven't signed up. Is it just a question of they're not available or not willing to, or what's going on there?
I think, thank you for that. I think what I would say is the uptake's been really positive. So there's around 850, clinics and pharmacists, out there that are eligible. And if we look at flu campaigns of past, there's usually about a 30% uptake. So that's about 250 of that group. And we have 182 pharmacists in the queue, and we have 122 docs are already through, and then we have 9 pharmacists that is also already through. So I feel like if we add all that up by the end of this week, we might be at our estimate of 30% of the available ones. So I think it's been quite positive. I should probably note that the fact that we have only 9 pharmacists officially through isn't due to lack of interest. As I said, there's about 180 in the queue. It's simply because they take, there's a longer onboarding process for the pharmacists as they get onto and learn how to use our public health information management system.
Yeah,
okay, thank you.
Add a point on that one. The 131 are the folks who are ready to go, basically. We've approved over 300 pharmacists and physicians, but they're still, as Johanu mentioned, in the process of finalizing all of the things that they need to do to be ready to receive vaccine. So the uptake has been fantastic. We're just trying to report so that Manitobans know what we're ready to do. But there are far more than the 131 who have applied and far more who have been approved and we're working with to get them ready.
Okay, sounds good. And earlier today, we heard that the super sites will account for about 70% of all vaccines. But just wondering about rural areas, will the focus there be on those pharmacists and clinics giving vaccines, or will more rural people also be directed to super sites?
So thank you for that. That 75% is when we look at the province as a whole. So the 20,000 doses a day would reflect what we're pumping through the entire province. So the question that you ask, and I think that the planning team is in the midst of working through as well, is if we go to a more regional level, what does that breakdown look like? Because as Dr. Reimer has said, the super site is one tool. It's our biggest tool, but it's one tool in the toolkit. So as we get more rural, as we get more remote, we will have to use different tools like pop-up sites or fit teams. And so obviously in those cases, as we get more regionalized, they'll take up a greater proportion of the amount of vaccines administered there.
Okay, thank you. Those are all my questions.
From CJOB, Alicia.
You've talked about this a little bit, but just in the broad general sense, taking in vaccine supplies, having enough staff, all the little quirks and things that come with it, how confident are you in a general sense that we will reach that 20,000 daily goal by April 1st? It's less than 6 weeks away.
Very confident.
Easy peasy. what happens or what is the protocol if someone at a group home or in a congregate living setting refuses to take the vaccine?
That's a great question. So Manitobans are encouraged to get immunized, but we are not doing any mandatory immunization for Manitobans, and don't have any plans to do so. Certainly, if anything like that were to happen, we would let you know. So whether it's somebody in a congregate living setting, in a group home, whether it's elderly Manitobans or healthcare workers, we want them to feel confident in the vaccine, in the delivery of the vaccine, to know that it is safe, that it is effective, that it is our strongest tool against COVID. Certainly not our only tool, but one of the strongest as we get more. And so we want to ensure that we are providing all the information that Manitobans need to feel confident in getting a vaccine. But that said, there will always be some Manitobans who decide not to get the vaccine, and we will try to reach out to them and ensure that we've met their needs, but we are not moving to mandatory vaccine at this time.
Right, but would you consider moving somebody out of a home or quarantining them inside the home if needed?
Yeah, so that's really a question for Dr. Rusin. We know that there is some planning going on around how we might adapt some of the public health measures once we have vaccination status as a consideration. But at this time, we are encouraging people to continue with the public health measures that exist, regardless of whether or not somebody is immunized. But certainly Dr. Rusin and the rest of the public health team are looking at this and will be updating you as things change.
Thank you.
Our final reporter this afternoon from the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. First question, I suppose, for Dr. Reimer. But what happens in congregate settings that might, or to residents in congregate settings that may fall through the cracks? I guess I'm thinking of those that may reside in an assisted living facility, but are currently in hospital at the moment. What would happen for those folks? Will they be vaccinated at the hospital at a different time? How would that work?
So we're going to be trying to do some redundancy to make sure that we're overlapping and reaching people in a variety of different locations. One of the things that's really helpful in Manitoba is that we do have a provincial database of all vaccine administrations, even outside of COVID, all vaccine administrations going back to 1981. So it is relatively easy for any healthcare provider in any setting who can administer a vaccine to look up someone's vaccine history and determine whether or not they need a dose. So some of the things that we're doing is going to hospitals and providing immunization to the long stay hospital patients. Often it's those who are waiting for admission to a personal care home, for example. We also plan to have potentials to come back to facilities if we need to in the future. And likewise, as future vaccines get approved, we may be able to leave vaccine at different facilities, something that we're not able to do with the storage requirements for the 2 mRNA vaccines that we have right now. And then there's also situations where someone may have received 1 dose and then they change where they're located and so aren't present at that same location for their 2nd dose. And certainly depending on whether it's Moderna or Pfizer, we could do things like have them come to a super site. We also plan to do some returns to facilities as well to capture people who may have been new admissions to those facilities. So there's a lot of plans in place, and while the vaccine is in relatively short supply, we're trying to target a more narrow group, but recognizing that once we have more supply and we're able to broaden that out, we will be able to reach more people and ensure that those doses are available.
All right, thank you for that. You've given out, there's a phone number now out there for eligible people for next week. When will the booking website go online? Will it be when there's more a larger population of people that are captured in the eligibility?
Yeah, I can field that one. Thanks, Scott. Right now, we are aiming to have the booking line ready for Q2. And at that point, it'll really need to complement the kind of traffic that we'll get in. I think what we want to reiterate today is that given the amount of folks eligible, we have more than enough capacity in the call center, as long as those who are eligible are the only ones who call.
Okay, thank you. That's all for me today. Thank you.
Thanks, everyone. That concludes our media briefing.